Good day, my fellow nurses. For today's video, we're gonna talk about a situation encountered by John. This will be a quick video on giving tips on proper assessment and intervention for his situation. So once again, I am Corvin and I'll be your nurse for today. The situation started with John, a second-year nursing student of the Lyceum Northwestern University, and is assigned in the nursery department for 7 to 3 shift. A baby boy was brought to the nursery for essential care. The case of the child was, the mother is 39 years old, primipara and diabetic person. She had the prenatal checkup. On her 40 weeks, she did not have any labor pain, so she waited for another week. When she is in her 41 weeks of AOG, she consulted her doctor and the mother was admitted in the hospital scheduled for cesarean section. At 7 a.m., the doctor performed CS, and then the newborn was brought immediately to the nursery department. As for the results of the assessment of the nurse, it is as follows. So as for the head circumference, we have the 34 cm, chest circumference of 33 cm, weight of 9 pounds, height of 42 cm, and temperature per rectum of 36.6 degrees centigrade, a heart rate of 138 BPM, and finally, an Apgar score of 6. As for the management and medicines administered, we have the terramycin ointment to the eyes. Second, we have the vitamin K 0.5 milligram injected intramuscularly at vastus lateralis. Third is the betadine solution or the povidone iodine solution placed on the stump of the umbilicus. And finally, we have the BCG and Hep B vaccines are given a day after the baby was born. The nurse noticed that the eyes of the newborn are swollen and the baby could hardly open his eyes. 2 days after delivery, the blood was extracted for newborn screening, and after a week, the result arrived and then the baby boy was positive for G6PD. Knowing this, the priority of the nurse would be giving comfort measures along with the medication as prescribed by the doctors. The medication, as stated earlier, would be terramycin for the eyes, vitamin K for blood clots, povidone iodine or betadine for sepsis, and lastly, BCG and Hep B vaccine for immunization. Additionally, further examination and assessment such as head and chest circumference, height along with the weight, and then the Apgar score of the infant or patient, and lastly, his vital signs are needed to provide proper and effective interventions for the client. Additionally, further examination and assessment such as head and chest circumference, height along with the weight, the Apgar score of the patient, and his vital signs are needed to provide proper and effective interventions for the client. Finally, proper health teaching is encouraged. Few of the topics that needs to be addressed are breastfeeding, care for the eyes as applied in the patient situation, and proper hygienic measures. For the breastfeeding, health teaching should be focused on enriching the knowledge of the patient in the benefits, position, possible risk, and overall knowledge in breastfeeding. It is also worth mentioning the possible risks or problems that may occur or be encountered during breastfeeding. Lastly, educate the support system of the patient in order to have a safe and secured postpartum activities. As for the care for the eyes, by carefully explaining the situation of the patient, giving assurances along with the medication discussion, the nurse can reduce the anxiety felt by the patient or the parent of the patient. By carefully instructing them towards hygienic measures along with the preventive and early interventions, the risk of prolonged infection can be reduced. And lastly, for the hygienic measures, by giving health teaching focusing on self-care such as doing sitz bath and dry bathing, the nurse can reduce the risk of the patient being susceptible to various nosocomial and bacterial infections. Lastly, by giving supplementary lessons to the patient's family, secured and safe postpartum can be achieved. I hope that you've learned something for today. The nursing care plan and then the drug study can be downloaded down below. And for more content like this, make sure to click that subscribe button and ring that notification bell. Once again, I am Corbin and I'll see you on the next video. Stay sharp and stay smart.